welcome to Hospital Mom Hacks. I'm Kyla Thompson, and today I'm going to show you some basic Gtube care on my daughter Isabella. So what I'm going to start with is cleaning the line. So if when you need the tape, the spots that you need to tape, I just use some little alcohol swabs. And it kind of gets the sticky residue off of this area for when you need to tape it later to the diaper and then tape around the disc. So Bella has a PEG tube. This is her G-tube. So I'm just cleaning the outside of it right now. And these little swabs help a lot getting the sticky tape residue off of there. Okay, so the best time to clean it is after a bath. That's when it needs, the G-tube is good if you keep it really dry. So what I do is after a bath, it's all kind of soggy around the area. I use just some saline solution in a little cup with a Q-tip. And this cleans the skin around the G-tube site really well. And then I just clean under here and get like there's big gunkies off. Like she has a couple dried ones right now. I won't do too much or she'll get mad. I'll do this later. But after a bath, when they're kind of wet and soft, they come off easier. And then I just clean under the disc with the Q-tip really gently and clean the disc itself and get it all scrubbed under there. And then I just grab a soft cloth and make sure it's really dry and pat it under there. Keep it dry. Dry is the best for the G-tube site. After I dry it, I rotate the disc to keep that site healthier as well. And then I always tighten it. So I pull up a little bit and tighten it to where it should stay nice and close to her skin and less irritation. You can also add some, I call it calm cream. It's the pink cream. And it helps if you add a little bit, like a thin layer of the calm cream under the disc. It helps with any skin breakdown or preventing any skin like irritation. So you can, I've also just left it, hers completely clean and dry without any calm cream, but you can add the calm cream just gently around there as well. And then, so after the cleaning is done, it's dry, and you may or may not put the calm cream on. Then the taping. So you want to keep this tight to the skin, so there's not as much, not as much granulation tissue forms. If it's nice and tight and less movement, the better. So this is how I do my taping. Just get both ends with this waterproof orange tape and lift the PEG tube up straight and get it right close to the disc and wrap it around really tight so it's right at the edge. And then it's got a little flag, easy to take off when needed, when you fold the edges. The other part you need to tape is where you're going to tape it to the diaper. So find a spot that is close to the diaper so it's not pulling away, because that can cause more skin irritation and granulation tissue. So keep it tight. Find a spot to tape close to the diaper so it doesn't pull it down. And then tape anywhere on the tube. Have a safety pin through the tape. And then nice and close to the PEG tube when you pin it on the diaper. Okay, so that's cleaning the site. I also clean the port. And I usually just grab a, well, all I have right now is a diaper. So I'll use a diaper. And this is how I clean the port, because it inside the tube can get a little gunky. See how it's kind of, you know, if you formula or whatever, it gets kind of gunky in there. So I also use some saline solution, anything to help clean it. I leave it clamped here, you can move this down if you want to clean more of the tube, but I'll show you more of the tube cleaning in a minute here. And then I just open up both ports and squirt saline solution in either side and let it drip out. And that cleans it really good. Like that. I also can use a Q-tip to sort of dry in there as well. Just dry the port out after I wash it. Okay. So there's cleaning the port area. Clean that back up. So, now where'd my flush go? Oh, well, I'll just show you. Sometimes the tube, you flush after every feed, but what I'll also do is have her water to flush into her tube, and I'll gently, before I flush it in, I'll gently rub and twist her tube a little bit like this, and it gets any gunkies out that are inside the tube kind of hanging out in there, and then you flush through and they flush all away, and then your tube is more clean, and then just use sterile water when you're flushing into their bellies. So the spots to tape, and that is it for our Gtube Care tips today. Some of you may also use little tubey wooby pads that go around. I forgot these. They also help keep the site dry. Keep the disc tight. And soother clip helps keep the peg out of the diaper area, and then you can just, I don't have her clothes on right now, but then you can just clip it up to her clothes. I should actually show you that. Okay. Then, whoop. You just flip it around. Anyways, okay. Thank you for watching today. I hope my basic Gtube Care has helped you. And thanks for watching. You can follow Bella's story in her blog at bellasmustardseed.blogspot.ca.